Hi, I am Eliana, and our group will be discussing the COVID-19 vaccination during pregnancy. Pregnant individuals are a special population that are at higher risk for more severe diseases from COVID-19 than the general population. While it is important to protect them from the virus, there is limited public knowledge about the safety of COVID-19 vaccines in this population because pregnant and lactating women were excluded from the initial COVID-19 vaccine trials. Thus, data to guide vaccine decision-making is lacking. Because of this lack of knowledge, many pregnant individuals are hesitant about getting vaccinated. Although there is a lack of knowledge, the CDC has stated that vaccination is unlikely to pose a specific risk for people who are pregnant, and already 30,000 women have been safely vaccinated. Even though the U.S. rate has been steadily declining for the past decade, there is still a large portion of the population that becomes pregnant and gives birth every year, close to 4 million. This large portion of the population must be taken into consideration when it comes to vaccination. Public health officials must prioritize gathering data so that pregnant individuals can make educated decisions about vaccination. If this entire population chose not to get vaccinated due to the lack of information or concerns about safety, that would still account for a large proportion of the population who are vulnerable. The key question pregnant women are asking during this time is whether or not it is safe and/or recommended for them to get a vaccine for COVID. Healthcare systems are severely impacted by COVID. Hospitals constantly had to reject patients or keep them in the hallway because they were operating above their capacity. Vaccination during pregnancy is especially important because pregnant women are an extremely sensitive population, and they are at an increased risk for severe illness that can result in intensive care admission, mechanical ventilation, or death. Taking this preventative measure of getting vaccinated will prevent such complications and allow for more resources to become available for other cases such as patients with comorbidities. Having a healthy pregnancy is directly linked to having a healthy baby. Healthy pregnancy involves visiting a primary care physician based on a recommended schedule. Over the last year, we have seen that many pregnant patients are very hesitant to visit their primary care providers due to the fear of contracting COVID. These screenings and checkups are imperative to grow a healthy baby. COVID-19 can result in severe health consequences on the fetus and will affect the healthcare system and resources indirectly for the next generation. In addition, most OB/GYN doctors are now encouraging patients to receive the vaccine since the risk of contracting COVID seems to be greater than the risk of the vaccine. Public health officials can help promote the safety data released about getting the vaccine during pregnancy to help give women a higher sense of security. Once more pregnant individuals are able to get vaccinated, they will hopefully be more comfortable going into their regular visits. In addition, getting vaccinated during pregnancy may pass antibodies to the baby and protect it from COVID-19 through passive immunity. Lastly, building trust is the core of a successful public health intervention. The CDC currently has a safety monitoring program following COVID-19 vaccinations called V-Safe. Patients are being monitored once per trimester, after delivery, and when the infant is 3 months old. With this data, researchers will be able to determine whether there is an increased risk for complications with the COVID-19 vaccine in pregnancy. As the most accessible healthcare professional, pharmacists play a key role in providing information to the public. Not only this, but pharmacists are many times actually administering the vaccines to patients. With the overwhelming amount of information the public is experiencing, it is becoming increasingly difficult to discern truth from fiction. In order to counteract this, pharmacists can step in as a source of information about COVID-19 vaccination while pregnant. They can counsel patients regarding the safety and risks of getting the COVID-19 vaccine while pregnant and also allow themselves to become a point of access to the vaccine for this group. Working so close with the public, pharmacists should be able to help monitor possible side effects that occur in pregnant patients under their care. Pharmacists are also tasked with advocating in order to increase community awareness and education on the FDA authorization of vaccine use, as well as the statement that the World Health Organization has released regarding the use of vaccine in pregnant individuals. Thank you so much, and we can't wait to hear your questions.